Good morning, everybody. Welcome to the July 26, 2022 in-service for the Meds Department on hoarding in the time of COVID. And I'm going to turn it over to Morgan and allow her to take over. If you have any questions, feel free, if you are on a computer, to type it into chat or just wait till she finishes. It's all you, Morgan.
All right, go ahead and pull up my presentation. All right, can you see this?
Yes, it shows up just perfectly. Thank you.
Perfect. All right, good morning, everybody. So as she said, my name is Morgan, and I'm doing the presentation today on hoarding in the time of COVID. So the objectives for today's presentation are to define hoarding disorder, to explain the impact of COVID-19 on hoarding, and to identify the symptoms of and treatment options for hoarding disorder. So we'll start off with defining what is hoarding disorder. So hoarding disorder is characterized by a constant need to save various items. So patients with hoarding disorder, they just feel the need to save a wide variety of things. And if they ever try to get rid of these possessions, it causes them significant distress. Now, it is different from collecting. Sometimes it can be hard to tell the difference, but collecting is usually focused on a specific theme. Like if you think somebody might collect coins or postcards or various things, and they might collect a couple different things, but this is usually something that's very organized and more narrowly focused. And they might have a catalog of things that they can go through and tell you about them, and it's something that they're really interested in. Whereas hoarding is typically very disorganized and encompasses just a wide variety of items. There's not really any sort of theme to what is being collected. Now, there is a small chance that hoarding can be organized. Some people might have, their items that are hoarded in boxes that are just piled up, and it's more of an organized system, but more often than not, these items are just all around. And the prevalence of hoarding is about 2.6% in the overall population. And it is more common in our client population and in people with other psychiatric disorders. So if you think about things like anxiety, depression, OCD, these people more commonly will have hoarding disorder as well. The risk factors for hoarding include a family history of hoarding. So genetics does play a part in this. Also, people with difficulties with planning, organization, and problem solving can also be at risk for hoarding disorder. And then also going through a stressful life event. So the trauma and the stress that's associated with these events is thought to potentially trigger a hoarding disorder. So now that we've gotten a bit of background on what hoarding disorder is, we'll now go into what happened as a result of the pandemic. So as we all have experienced, the pandemic introduced a lot of fear and stress worldwide, especially in our client population, because they were more at risk of developing serious complications from COVID. And in the beginning, there was panic buying of cleaning products, toilet paper, so much toilet paper, and food. And the issue with this panic buying is that this was misunderstood and mischaracterized as hoarding. But the panic buying was occurring through the majority of the population. A lot of people were buying up all these items, and it's different from a clinical hoarding disorder. So the issue that the pandemic created with all this panic buying is that it increased the stigma surrounding hoarding disorder, because people were just throwing around the terms hoarding, like, oh, my neighbor's hoarding toilet paper. And that created a bigger misunderstanding of what hoarding disorder actually is. But even though this panic buying was not hoarding, hoarding itself did increase during the pandemic. So rates of hoarding increased, as well as the symptoms of people who already had a hoarding disorder also increased with the pandemic. And then those with hoarding disorder did report a decreased quality of life and increased mental health symptoms during the pandemic. So overall, it was a negative effect of the pandemic on hoarding disorder. So now we'll go into how we can recognize hoarding disorder in our clients and how it's treated. So here I have some symptoms to watch for if you have a client and you might suspect that they may be hoarding. These are some of the things that they might exhibit. So usually people who with hoarding disorder will gain their possessions a lot of times on impulse and often in excess. So whether they're actually buying these items or not, it's usually impulse that causes them to grab them or buy them from a store. And then they also have an intense need to save all of their possessions. And if they're asked to get rid of them or faced with the need to throw things away or give them away, they have a really, really hard time with this. Even if it's something that the outside person will look at and say this doesn't have any value, it is really extremely difficult for these people to get rid of the items, and it causes them a lot of stress. Also, the number of possessions that these people have usually will over time end up cluttering living areas. So as you can see in the picture, this is a pretty severe case of hoarding where it basically makes the space unusable. So they can be, items all over the kitchen, all over the living room to where you can't even sit on the couch. It might be in the bathroom. So they're just everywhere. And then there also is a specific type of hoarding called animal hoarding. So people who have an animal hoarding disorder may own an inappropriate number of animals. This may be 10 animals in a small apartment up to hundreds of animals in a house sometimes. So usually people who have animal hoarding disorder, there's too many animals to maintain the cleanliness of the space, and it's usually not good for the animals themselves because they're overcrowded. So these can all be signs for someone who has a hoarding disorder. Some of the negative consequences of hoarding include an unsafe living environment. So like I mentioned before, the clutter is often all throughout a room, makes the room unusable. So this can create tripping hazards, which is something really important for our client population because we really don't want them to fall. Can also create a fire hazard, especially if things are piled high to the ceiling or blocking exit ways. And it may become unsanitary. You can get things like mold growing. It's very dirty. It's hard to clean around all these objects because there's just too many of them. Can also create strain on relationships with loved ones. If the client has children or grandchildren who are coming in and they're letting them know that they have a problem, but they may not recognize it or may not be willing to get themselves help. It can create a lot of strain on that relationship. And it can also cause loneliness and isolation. They might feel embarrassed to ever have people over, so they might not partake in social activities as much, and they can kind of become trapped in their own possessions. It can make it difficult to perform tasks like bathing and cooking because, as I said before, the clutter can often be in bathrooms and kitchens and make it difficult to perform the tasks that are normally supposed to be performed in these rooms. And then lastly, it can create financial issues. If the person acquires these items through purchase, if they're acquiring a lot of things based on impulse, that can create a huge financial strain if they're spending a lot of money. So if you have a client who you suspect may be hoarding, I wanted to go over some do's and don'ts for how to talk to them to best, help them and make them feel more comfortable. So first we'll go over the do's. So we do want to use the same language as the client when talking about their items. So we want to be careful about referring to their items as trash or junk. Take the time to listen to them and see how they refer to them. If they call them, my things, then you should call them their things. Try to use that same language to make them feel more comfortable and not as stigmatized about it. And when you're letting them know about their hoarding disorder, maybe giving them information about it, you want to place an emphasis on safety. So bring up some of the things I talked about on the previous slide, like, this clutter can create a fire hazard or a tripping hazard, and I'm just really concerned about you falling and ending up in the hospital. the main emphasis is on the patient's or the client's safety. We also want to offer help or recommend professional help. So that's always a great thing. If you feel like it's something you personally can do, definitely offer your help. If it's something that's out of your realm, then try to recommend professional help for the client. And then also help set manageable goals. So if you are going to be the one helping the client, then help them figure out which goals are going to be easy to reach. So not, cleaning out their whole apartment in a week. That's just not attainable, especially with the amount of stress it causes just for them to try to get rid of one item. So try to set more attainable goals for the client and help them realize that it is going to be difficult, but in the long run, it will be the best thing for them. Now, some don'ts in how we want to talk to our clients. We don't ever want to be judgmental or discouraging because this will only alienate them further. We also don't want to tell them what to get rid of. It's really important for the client to, over time, recognize themselves what needs to be discarded versus you just pointing out piles and saying, this needs to go, because that's going to make them very, very distressed. It's also very vital to not clean up after the client. If you were to go in without their consent and just clean out all of their possessions, it's not going to make the hoarding disorder better. It'll actually make it a lot worse because they might feel betrayed that you did this behind their back. These are things that they were not ready to get rid of, and it'll really just make it worse. And also, we don't want to minimize the difficulty of recovery. This kind of goes along with helping set manageable goals. So we want to make sure that we don't frame this as something that's going to be really easy, because it is going to be difficult for the patient, but just let them know that they are supported in this and that it will be the best thing for them. Now, if you do have a client who recognizes that they need help and they want your help, or they want, some advice on how to declutter their living space, here are some useful tips that you can give to them. So some of these include telling them to start by getting rid of one item a day. Eventually, this might, escalate to getting rid of more items per day, because this can take a long time, but starting with just one item a day can be a more manageable goal for them. Another alternative to this is to say, start by working on decluttering 5 minutes at a time. So this is a very small period of time, but it can kind of get them used to that process of starting to get rid of things. They can also use the 12-12-12 rule. So the 12-12-12 rule is when they go into a room and they identify 12 items that they want to keep, 12 that they can donate, and then 12 that are just trash. So this can be useful. You can create 3 different boxes for them, and they can just start area by area doing 12 at a time. And this kind of keeps it so that they're getting rid of more than they're keeping. A tip for clothes is that they can change the direction of their clothes hangers. So you can turn all of your clothes hangers backwards in your closet. And then as you wear the clothes, you can flip the hanger back in the right direction. And then after a couple of months, you can look at your closet and be able to easily see which hangers are still turned backwards. And that lets them know that I haven't worn these in a while. Maybe I can finally get rid of them because I can see that I don't need them. Another tip for clients is for them to enter their home and act like they're a visitor entering it for the first time. Because a lot of times when we're in our own space, we kind of have a different lens on as the person who's living there, and it's harder to see any issues with the space, or they might not recognize as much all of the clutter that's around because they're so used to it. So if they were to walk out the door and pretend like they're somebody else, maybe a friend who's seeing their home for the first time, and they walk in and see all of the clutter, they might finally realize, oh, this is embarrassing, or I might be uncomfortable if I walked into somebody else's house and it was like this. And then it might help them recognize more that they need to declutter. Another option is to start with a very small area, like maybe the kitchen table or even part of the kitchen table, and quickly clear off all of the items that are on it, and then take a picture of the area. And also take a before picture of before they cleared off the items. And so that's an easy way, comparing those before and after pictures, to see what it could look like without all the clutter on it. And then that might encourage them to say, hey, my place can look really nice actually if I get rid of a lot of this clutter. And I hadn't thought about that in a long time. And then finally, for our more tech savvy clients, they can also digitize their clutter, or they can have somebody help them do this, maybe a loved one, or maybe we can help them do this, where if they have a lot of small items that they're saving, not because they want to use them, but just because they have sentimental value and they like looking at them from time to time, we have a great option now, and it's these. So we can use our phones or cameras to take pictures of these items and store them on a device or on the cloud, so that they can still access these pictures, but then they can get rid of the items themselves, so they can still have the memory but not actually have the physical clutter. So these are all just great tips that we can give to our clients. And now there are a couple of treatment options available for clinical hoarding disorder. So these include cognitive behavioral therapy and medications. So first we'll go into the therapy. So cognitive behavioral therapy is something that is usually performed across many different sessions over the course of 6+ months. So this is something that takes a long period of time to work, and clients have to be committed to it, but it is thought to be very useful. Probably one of the most useful things that we can do for hoarding disorder. So you have a mental health professional that will help the client, focus on developing their skills in problem solving and organization, help them recognize the symptoms of their hoarding disorder. And this can be really useful to help them along this process. And also sometimes it can incorporate in-home sessions so that the client can feel more comfortable in their own space, but then the person who's conducting the therapy session can actually help them perform some of these skills in their own home and help practice these skills for decluttering and for organizing. And then our other option along with therapy are medications, but I wanted to note that research is very limited on medications for hoarding disorder. It's really, most of this is based off of medications that we use for obsessive compulsive disorder, or OCD, because the two conditions are thought to be pretty closely related, but there's not much research specifically focused on hoarding disorder. But the medications that the most research exists on are the SSRIs and the SNRIs, which are commonly used for depression, anxiety, and OCD. So the SSRIs, like I said, are shown to be effective in OCD. So they're thought to be effective in hoarding disorder as well. Some examples of these medications include sertraline or Zoloft, also Lexapro, and there are several more. Notable side effects for these medications include nausea, weight gain, and insomnia or sedation. So they can cause, difficulties with sleeping, either not being able to sleep at all or sleeping too much. The one thing I want to note, just because there's not much research on it, there's also not established doses that are recommended. So if you were to see a client who's taking these medications and they say it's for their hoarding disorder, it'll be hard to tell if they're taking the right dose of the medication, because it's kind of a guessing game, honestly, because we just don't have the information. So most prescribers will probably just guess at what an effective dose might be based on other disorders like OCD, perhaps. And then there's also the SNRIs, which are related to SSRIs. An example of this would be venlafaxine or Effexor. This one has the most research out of the SNRIs on hoarding disorder. And its side effects are similar to SSRIs, but it also has the added side effect of increased blood pressure. So with our patients who have high blood pressure, this probably is not the best treatment option for them. And then there are some medications that, they have proposed might have theoretical benefit for hoarding disorder or might be researched in the future because they think that they could have some link, some benefit. So I wanted to go ahead and bring them to your attention because in the future, we might see these medications be used for hoarding disorder if they're found to be effective in future research. So these include our medications that enhance cognitive abilities. So these are things like donepezil or Aricept and galantamine, brand name Razidine. And it's thought that these might increase organization and the client's ability to discard items. So this could be a potential treatment option in the future. And then also it's thought that the stimulants that are used for ADHD might improve attention and processing of information, which would help with organization skills and potentially help with hoarding disorder. And then here I just have some resources. If you want to know things that you can offer your client, if you don't feel equipped to help them yourself, but you want to at least be able to point them in a direction or their families in some direction, give them some help. I did include a few links here or names of resources. There's Clutterers Anonymous, which is just as it sounds, it's the equivalent to AA and those other groups that have a 12-step process and can help them get support from other people who have hoarding disorder. There's also Children of Hoarders, which, as the name implies, it is meant for children of hoarders. It's more of a resource to help with family members. There's also the Clutter Movement Individual Support, and this is a Facebook group that people can join to get support from other people with hoarding disorder. And then there's also the International OCD Foundation, which does have a website dedicated to hoarding, and it has resources for, explaining what hoarding is, how it's treated, how it can be managed. So that's a great resource for people as well. Then here are my resources, and I would be happy to take any questions at this time.
Let's see. So does anybody have any questions for Morgan on it besides me? Because I actually have one. For the Children of Hoarders, Morgan, is it adult children or is it defined children? Because it could be.
Yeah, I think it's more just for family members of hoarders. It's called Children of Hoarders, but it says on the website that it's meant for children, but I think, it could be for spouses as well. It's really just for a family support kind of resource.
Okay. That's excellent. That's very useful to know. So does anybody have any questions for Morgan? You might be lucky and you might not have any questions.
I'm totally fine with that.
I'm not surprised. It appears that you don't have any questions. So,
all right.